I don't know how to express it, but it has medically sort of caused me a shortness of breath, and I'm worried that this shouldn't lead to any heart problem.
We need to differentiate stress-induced symptoms from stress-induced cardiac problems. Does stress affect the heart? Obviously, yes. There's something called as broken heart syndrome. We see that these patients suddenly present with severe chest pain and breathlessness.
So, Dr. Sahab, recently I've broken up with my partner, very nice girl, but we didn't get along well towards the end. So this has created emotional imbalance. I don't know how to express it, but it has medically sort of caused me a shortness of breath, and I just feel odd, and I'm worried that this shouldn't lead to any heart problem. What should I do?
Well, see, stress is a very non-quantifiable factor. Yeah. So I think stress can cause a lot of symptoms which may or may not be related to the heart. The way stress plays on your mind, you can have symptoms of breathlessness, uneasiness, chest pains which come up off and on. And of course, a lot of mental disturbances also. I think we need to differentiate stress-induced symptoms from stress-induced cardiac problems.
Okay.
Now, yes, does stress affect the heart? Obviously, yes. There's something called as a broken heart syndrome. And that's, it's something which happens when you have severe mental stress, like loss of a very dear one, or a separation with and severe stress with that. Where we see that these patients suddenly present with severe chest pain and breathlessness. And the next thing we know that the ECG shows a heart attack pattern, already evolved, not even an acute heart attack, an evolved heart attack pattern, and there is a dilatation of the heart muscle. And the heart gets dilated and starts pumping less at 20%. So, and typically happens in the front in the front side of the heart. So, it's called as a Takotsubo cardiomyopathy, and after the person who first detected it. The good part is this happens acutely, but 99% of the times it recovers back to normal over a period of time, leaving no scars behind. Okay. We don't know the etiology behind it, but probably severe stress causing some spasm of the arteries in the heart.
Does it create a low blood pressure or something?
If the heart pumping goes down, then yes, the blood pressure can also drop. But sometimes even severe stress can cause either extremes of blood pressure or heart rates also. So basically, I think you just get your routine investigations done, get a routine ECG done.
I notice even while talking to you, this is distressing. I can't.
So that's like I said. What we see is that pure stress and anxiety, and to a large extent depression, causes a range of symptoms. And typically, a lot of them come to us with chest pains, breathlessness, feeling uneasy, a feeling of doom. And they say "ghabrat ho rahi hai." So these are symptoms which happen. Of course, we can't ignore those symptoms. So what we do is get an ECG done, get a 2D echo done, get a routine bloods done. It tells you if there's anything specific that we're looking at or not. And if all these investigations are normal, then we just work on the stress and anxiety and try and take care of it. Every breathlessness or every chest pain is not cardiac. There are various reasons for it, right? There are 100 reasons for chest pain. Heart is just one of them. So, the moment you have chest pain doesn't mean that it is cardiac. It could be various other things. So, we listen to the patient. We hear out the history. The history tells us a lot about whether this pain is cardiac or not.
Okay.
In your case, it doesn't sound to be cardiac.
Okay.
So, I presume they just get the investigations done. If they are normal, then we are through.
All right. Thanks, Dr. Sahab.